Our next speaker is Ryan Milne. Ryan is the founder and a principal consultant of ECOSAFE International, which is a specialist consultancy focusing on the interface between water and health. Ryan has a master's degree in science and extensive local as well as international experience within the water risk management sector, spanning health and aged care, mining, oil and gas, remote sites, government and commercial facilities. He has a particular focus on the holistic, practical and effective management of on-site potable, recycled waste and process water systems. And he will take some questions after his presentation, so make sure you have the app fired up and we'll see if we can get to those. He's speaking today on the topic Effective Risk Management, a Different Perspective. Welcome, Ryan.
Thanks, Rob. Also a great opportunity to be here, so thanks for that. As Rob alluded, I'm not a plumber. I'm a scientist, so hopefully I'll bring a slightly different perspective to the conversation and just put some food for thought around the training skills set within plumbers. And, you know, we all celebrate what plumbers do in terms of protecting public health, but what do they do potentially to impact public health in a negative way? So I'll touch on that. So just a bit of context in terms of who we are and what we do. Essentially we work across any water body, so from potable water, recycled water, wastewater, processed water, and it's really about that interface between water and health and protecting and understanding what is the risk. So personally I'm a lead drinking water auditor or water management system auditor. So any of the utilities get audited, they need someone with that sort of accreditation. The reality is we get to, one of the best things about the role is we get to operate across a number of facilities, across a number of countries, so from hospitals to oil and gas platforms, mining sites, remote communities, and often we end up dealing with the plumbers. Obviously because in terms of maintaining managing water systems, the plumbers generally get put in that role in some capacity. So what I'll share with you today is our perspective around that and then sort of go from there. So yeah, the main bits and pieces are really around unpacking what is water quality and what is water hygiene, what can impact water quality and hygiene, some of the typical challenges we've seen. So what are the challenges we see out there? And then ending off with looking forward. So where do we go from here, or where do we think we should go from here? So first of all, in terms of water quality, the media love a brand new story. As we know, water is emotive. We all need water. So it is becoming more of we get more and more work today because of a brand protection rather than just regulations 10 years ago. So that landscape is definitely changing. So why do we need to worry about water quality? There's a number of reasons. Obviously, public health is number one. Consumer satisfaction is probably number two. And then infrastructural maintenance considerations, so cost. If we don't manage water quality, obviously it can impact infrastructure, and that can be very costly. So what can impact water quality? There's a number of factors. If we look at the top, the main four is really around the micro, which is the bugs, so that's the greatest risk. Then we've got chemical, inorganic and organic. We've also got physical or aesthetic issues and radioactive. So we can't just look at water quality in the context of drinking water. We've got to remember water quality can impact others in many different systems. So that's where we bring or overlay the concept of fit for purpose. So is that water quality fit for purpose in terms of a health outcome? And that's obviously other systems. And the question I have, plumbers are not only working on potable water systems, they're working on processed water systems, wastewater systems, and generally what is their understanding of water hygiene? And having worked in third world countries, first world countries, there's definitely a gap that we see over and over again. So in terms of those microbugs, if they are the biggest thing that can impact water quality from an acute health risk, we've got to understand that there's different pathogens, there's enteric pathogens, there's opportunistic pathogens, and there's different types. And the concept there is just to recognise one treatment doesn't address all pathogens. So we've got to look at it, every system from a risk-based point of view, not one size fits all. And this is a challenge we often see, particularly in remote communities and the like. Aesthetic is also an issue as well. Perception can be a very big thing. We often engage by clients to help them work through a perception issue where a site or a local community might regard the water as not being suitable to drink from a health perspective, but in reality it's only an aesthetic issue. So we've got to look at water holistically and understand that it's not just about the quality. It can also, aesthetics isn't a quality, but it's not only about the health impacts. So I'll ask you for a bit of poetic license here. I'm going to generalise, but this is our perception, obviously, going to site when there's to do an audit, to do a risk assessment. Sometimes when people are presumed to be sick or are sick, we'll get engaged and come and investigate. And so I've gone with what are the top 5 things that we see as the biggest challenges, and this is from a plumbing perspective. So auditing, working with plumbers, managers. Number 1 is generally complacency. So we've never had anyone get sick here. We've never had E. coli in our water. And as soon as I hear that, I know there's a massive, massive problem on that site. Lack of awareness or understanding of the potential actual pathogens or risk in the water. So no understanding of, we're not only dealing with enteric pathogens, but also opportunistic pathogens, so bugs that can literally grow within your system, like Legionella as well. How where you're located can impact what type of pathogens you got. For example, if you're in the area where there's cattle, it's very different from an area that's not. So all of these types of things. Lack of awareness of the importance of disinfection residuals. And I get it, not everyone disinfects water in every part of the world. However, it is a barrier, and it's your primary barrier in most circumstances from a drinking water perspective. So a lot of the time we don't understand what a site level, it's not often understood that barrier needs to go to the end point. Insufficient preparedness for adverse water quality issues, things like pipe bursts, pipe breaks. It astounds me how many times we are involved with investigations or a risk assessment and there'll be no flushing to test free chlorine before bringing our system back online when there's been a burst or a break. We cannot just rely on a flush, we've got to rely on that residual being to the end point. And then obviously inadequate updated management plans and supporting procedures. So that's what I'd say the top 5 are. There's a number of other challenges, and this is where I believe particularly plumbers are not being set up to succeed, and hence that takes us into what we call that gap analysis or skills analysis. So general lack of awareness or understanding of the waterline, the applicable guidelines. So plumbers obviously have generally a focus on the plumbing code. That's what they're trained to do. We've got to recognise it doesn't end there. If you're involved with managing, operating, and maintaining a water system, we should understand the guidelines and how that fits into that system. Lack of training or awareness around sampling. Again, plumbers are, typically the guys that often at a site level suddenly inherit water quality sampling. So have they been trained? Do they understand sampling protocols? Interpreting the results. That's another challenge, or the significance of the results. Again, astounds me how many times we've had consistently bad results at a site level and it just hasn't been understood in terms of what it means. The alarm bells have been ringing for a very long time and it waits until someone gets sick. Inadequate to be able to interpret, I've spoken about that one. Corrective actions delayed or not performed effectively. Disinfection of systems, superchlorination. We go to sites and there's no concept of chlorine contact time. So we've got standards, we've got all sorts of things, but in reality, if it's not applied correctly, we're not actually doing remedials effectively, and that results in potentially another public health issue. System commissioning challenges. So this is another big issue. Typically, plumbers want to charge a set of water pipes in a new building as soon as they can. So if anyone drills a hole, it's not their problem. But in reality, that can result in a water quality impact downstream. in terms of when is that handed over, that building, and what's happened to that quality in between. So understanding that sort of side is very important as well. Yeah, interpreting the monitoring results. So plumbers often, again, doing the operational monitoring, day to day, week to week, like flush times, free chlorine, temperatures, and actually don't even actually appreciate the importance of that. It's a lead indicator rather than the lag indicator when we send it to the lab. When we get a bad result back, the reality is potentially someone's already been exposed. It's too late. The horse has run. So plumbers don't often recognise that importance of the data and the record keeping of what they're doing at a site level. So those, I'll share a few in the field sort of examples and give a bit of context on each one. This was an interesting one. A remote site, spent millions of dollars on a very, very big water treatment plant, and plumber was responsible for maintaining the plant. He actually did have a Cert 3. This bloke had a Cert 3 in water treatment operator, but he wasn't operating his free chlorine residual meter correctly. Had purchased the reagent from the pool shop. And what happened, what that resulted in, it was basically running the endpoints to 0.3 free chlorine instead of 0.5. So you'd spend all this money, but you still had a risk at your endpoints. This was in a northwest of WA, so very warm, opportunistic pathogens are a major risk. So we've got to maintain 0.5 to endpoints. So very simple, again, not an understanding of what the water hygiene impacts are and how important, something like the free chlorine residual monitoring is. These again are pictures from sites where we've had interactions with plumbers, missing tank lids. Interesting piece of wood is a bottom drain valve. That if that's lost, you can say, oh, there's no potential health impact, but there is generally an indirect, health impact, because we've had sites that have run out of water, things like that, suddenly running around, fill a dust truck with water and use that in the drinking water system. So we've got to be aware that these types of things, if plumbers have been set up to succeed with general water hygiene training, they would straight away understand that it's not tolerable. You can't have an open lid on a tank. This was an interesting one. So we're working more and more with hydraulic designers as well. One of the challenges we often see in aged care and healthcare facilities is installation of UV systems and what that does to chlorine residual. So when we're talking about managing Legionella, for example, that basin in the middle there was a building, a year old, put in a UV unit as designed by the hydraulic engineer, took all the chlorine out, and essentially a year later we got engaged. People are sick, a few cases of Legionnaire's disease, had to take 20 people out of a wing of the aged care facility, and essentially it was because they'd had a UV system on it, stripping all the chlorine out, and your Legionella and biofilm was established in the hot water system. So, it's not rocket science. That was after we did a disinfection. You can see the amount of muck coming out of that, and that's after 12 months. Screening of overflows, things like frogs in tanks. Been to sites in communities where open the lid, there's frogs, there's bung arrows, and the plumber's response is, no, they've always been there. How many times have people got sick thinking it's the curry, meanwhile it's the water they're drinking? Yeah, this one, just some water treatment. So again, obviously there's different levels, but the plumbers are generally left with managing the water treatment equipment. So there's a site there, that was the middle free chlorine residual analyzer had 2,000 people on site, 0 free chlorine, and had been like that for 6 weeks. So again, not understanding the importance of that critical control point. The bottom right for you guys of that, that's a UV lamp. Obviously plumbers require to clean it. It's in his maintenance contract. Look how scaled it is. That's not doing any good at all. It's not going to be doing its job at all. Again, it's a lack of understanding of the importance of that UV unit or the maintenance around it. The top left one for you guys is also a UV unit. Plumbers had isolated it to maintain it or clean it and left it isolated. It's a dead leg. It was found 6 months later when we came to do a risk assessment. Oh, it's been like that for 6 months. Again, no checks in place. You're not managing the water as it should be managed. Pipe bursts I've spoken about. The left one is there, really materials and substances in contact with drinking water. So using stuff that's not suitable for contact with drinking water. Spoken about the bursts. There's uncapped pipework. Shouldn't be like that. Dead legs. There's a plumbing solution for cooling, putting in place a little cylinder to store the water, to cool the water before an emergency shower, not realising that's a perfect environment for the Legionella Naegleria and others. Dead legs, again, awareness, it's not rocket science. The plumbers are generally the people on site walking around, so that's where the water hygiene awareness training really becomes effective. Also, still really surprises me how many plumbers that don't have a separate tool set, using the same tools on black water as drinking water. We still see it. Can't believe it, but it still happens. So what does delivery, what does good look like? We've got to understand the water quality risk to the consumer. That's awareness of the hygiene. We've got to implement barriers. We've got to monitor and make sure that it's working. And essentially, we've got to recognise it's a journey. So it's not a switch we flick. It is a journey, and plumbers need to be on that journey, in my opinion, right from being apprentice to the continued, educational sort of part of it. Mark McManus mentioned yesterday the mission statement of providing skilled manpower. To me, it doesn't end. This water hygiene is a major part of that skilled manpower. It's not just about putting in a pump or changing a pipe. So what do we do moving forward? In terms of change, number one is always awareness. So hopefully this gives a bit of an insight. Awareness is always number one. It's the key to changing anything. If we're not aware, even in our own self, what we need to change, nothing changes. So in that water risk management journey, we've got to really empower the licensed, or the training should empower the licensed plumber to be more confident and competent, improve public health outcomes, obviously help them with their continued improvement or development, and provide them update with standards and guidelines. So just in the healthcare space and aged care space particularly, we believe people are more susceptible in that community. There's a need there for plumbers doing work in any of those to be definitely have an awareness training of some sort, because the risks are that much higher. So there's a number of different training things from Cert 3 through to others. In terms of record keeping, so we work with a lot of clients, and one of the things we're pushing them towards is what we call a compliance tool. So plumbers don't recognise the importance of those records, the daily checks, the flushes. Often it's on a bit of paper, got water on it, or it's never filed, it's on an Excel spreadsheet. And when something goes wrong or someone's sick, those records become very, very important. So something like a compliance tool is very useful, and what we believe is the way forward in terms of working smarter with automated data capture, automated reporting and the like. And then just ending off, incident response protocols. We go to site, something's gone wrong, and people are asking, what do I do now? Who do I speak to? When should I do it? We've got to equip the plumbers and people on site to actually know what to do, when to do it, and who should be involved with even things like communication. If we don't, essentially that's where things can really go wrong. So ending off last bit, plumbers can impact public health, so they need to understand there's a responsibility that comes with that, and with that comes that awareness of water hygiene. There's no shortcut to it. It is what it is. So my question to you guys is, it's an intentional decision that has to be made, and what is it that we think we're going to be doing about it? So thank you very much.